for elastic, cartilage, is that elastic cartilage with normal H&E staining, it won't be able to pick up the stain. Therefore, you have to use a special elastin stain, which is known as Osin stain. It's going to give this black, appearance, make it dark. They are slender compared to that of the, fibrocartilage. Sorry, compared to that of collagen fibers. But remember that in addition to these elastic fibers, you're also going to find these, type 2 collagen fibers. Now, in addition, it's also going to have this perichondrium. Yes, that one also be there. But one thing that we find is that, yes, assuming this is it, these are the lacunae with the extracellular. Apart from seeing the cells singly, these cells are going to be larger. The chondrocytes are going to be larger compared to that we find in the hyaline cartilage. And then in addition, they could be in twos. Yes, in twos. So they don't really form that nest, nature of cells. So that one too, you can see that one there. So the perichondrium, and then these are the cells. And they are not going to stain with the typical, H&E stain, except using Osin. You are not, going to see it. Yes, essentially, where you are going to find it, yes, the auricle of the ear, external auditory meatus, you are going to find it there. The eustachian tube, you are going to find it there. Yes, the epiglottis, the cornicunates, yes, of the larynx. Yes, you're also going to find it in the cuneiform, cartilages. You're going to also find the apex or the most typical portions of the arytenoid cartilages. You also find, these elastic cartilages. But remember that because when you get the freshly sectioned ones, they appear, yellowish, and therefore you also call it yellow elastic cartilages. Now the next one that we want to end with is actually fibrocartilage. Now for fibrocartilage, yes, you are going to find both type 1 and type 2 collagen fibers. Both type 1 and type 2 collagen fibers are going to be present. Now, but usually is the proportion of these, ratio of type 1 and type 2 collagen fibers which characterize a particular fibrocartilage. Now, for fibrocartilage, there's that kind of confusion with the dense regular connective tissue because it tends to have this regular pattern, so that having these slender light cells, in a regular pattern. So sometimes you don't see it with interspersed, fibers by running in a regular fashion. When you tend to see this, then this is likely going to be with cartilage, then it's going to be fibrocartilage. But usually it tends to have that, close resemblance to dense regular connective tissue. But so the cells are in rows. They tend to be in rows or linearly, oriented, and there are no isogenous groups. And this time around, you are able to see, the fibers very well. Of course, because there's type 1 being present. Now, one thing that we find is that, yes, for fibrocartilage, it tends to be found in the midline of the body. Yes, if you take the intervertebral disc, actually the annulus fibrosis aspect of the intervertebral disc, when you look at the symphysis pubis, they are going to be there. When you look at the articular discs of the temporomandibular joint, they are going to be there. Yes, the articular disc that separates, the trapezium, from the ulna, that was we're going to find fibrocartilage. The glenoidal labrum, acetabular labrum are also going to find, fibrocartilage, although they are limited, but these are some areas that you are going to find them in these locations. Now, I said that there's a proportion of the type 1 and type 2. Typically, if you take the intervertebral disc, there is that kind of equal proportion between the type 1 fibers and the type 2 fibers. And so for instance, if you look at the symphysis pubis, there will be that variation in that kind of regard. Alright, so ladies and gentlemen, this is a quick tutorial, yes, regarding these cartilages. And we've seen the hyaline cartilage, we've seen the elastic cartilage, and we've also seen the fibrocartilage. Thank you.